Hello, Kaweah friends and family. Welcome to our community engagement webinar. Today's Thursday, September 22nd. My name is Kelsey Davis, and beside me we have our beloved CEO, Gary Herbst. Gary, good to see you.
Yeah, you too, Kels.
So it's been it's been over 2 months since we last saw you here
Yes.
on the webinar, and you were getting ready for your sabbaticals. Can you tell us a little bit about what you did?
Yeah, well, thank goodness for photographs and memories because I've been back 22 days and it definitely has been a jam-packed 22 days. Unfortunately, the world did not pause while I was gone, and certainly that wasn't the case at Kaweah. So a lot of things to come back to, and but we did have an absolutely wonderful time. I think the highlight is just, be able to just time with just my wife and myself. We didn't have our kids with us. We didn't, travel with friends. It really was just us. And I was sharing with the folks here that my first day was September 1st, a Friday. And so that felt kind of weird. And I was just thinking, oh my gosh, I don't go back to work for 2 months. And that seemed like such a long time that it was gonna feel like it would last forever. And we went over to Pismo, saw my dad over there for a few days, and came home for a couple days, and then we left for Hawaii. We'd actually bought tickets and had rented an Airbnb back in March of 2020. But then COVID hit and everything shut down, and so we literally have been sitting on that until now. So finally got that chance and went over to the Big Island and on Kona. Came home. We were home one day, just enough to unpack and wash clothes and repack, and then went on a 7-day Alaskan cruise, which was fun because we've been on cruises before, and I thought I had reached the age now where, generally I always thought it was older people that went on Alaskan cruises because, in your younger days, you're going on the party crib, the carnival cruise. Yeah, exactly. Well, was I wrong? Kathy and I felt like we were the oldest people on the ship, that there was tons of very young people, and it was an absolute party boat. 3,000 people and 20 restaurants and 20 bars, and
So you had fun.
But I couldn't keep up. So no. So we probably were the earliest to go to bed every night, and but no, had an incredible time. Alaska is just fantastic. Then came home just for a couple days, went over to Paso Robles and celebrated my wife's 60th birthday. I'm very low key. My 60th birthday actually was in the midst of COVID, so we didn't do a thing, but I'm not really, into big birthday celebrations, but my wife's on the opposite end. She wanted a big party and everything, so so we had one in the caves at Eberly Winery, which was really fun. And then we were home one day and then flew to Italy. And we spent 8 days in Florence and 5 days in Sorrento. Had never been to Italy. So it was really kind of a dream vacation, incredible. You think about our country, more than 200 years old, which sounds, like a long time. But we were in the town of Parma that was founded in 59 AD, over 2,000 years ago, essentially. It's just the history, it's just incredible. So, so that was probably definitely the highlight. And then came home for a few days and kind of, tried to unwind and get ready to come back to work. And so, I came back on September 1st. Today's day 22, if I didn't say that already. And I did say it went by in a blink of an eye. I would say it was challenging not to think about work. It's an incredibly busy time when I had left, and I didn't stop thinking about work. I knew it was in fantastic hands, so that gave me great peace of mind. But I think what made it a little bit easier is just staying really, really active. Because when you got a lot of downtime, your mind has a lot of opportunity to ponder. But when you stay really busy and everything, I think that was, and that the board, they told me, get out of town, leave for 2 months, and try to get away, and that was probably good advice, and particularly to stay, really busy. So, but it's good to be back. It really is. I did miss all the people, and I concluded that I'm not ready to retire.
Good.
Because the few days when we got back from Italy, we were home about 5 days, and I gotta say I became bored. And so I don't think I'm ready. So
You have to have really good hobbies to keep you busy.
exactly. I think I'm going to be one of those people that has to be active all the time. So yeah.
So when you got back, how did you handle being back? Did you jump right in? Did you try to ease into it?
I think I'd mentioned before I left that Cindy Moschio, my executive assistant, had actually found a guide to sabbaticals, what to do in the months leading up to it, what to do while you're on sabbatical, and what to do when you get back. And it did speak about kind of easing in and transitioning, and I will tell you, that manual did me no good, because on the very first day it was like I was never gone. I think I was here till 10 o'clock that night, and but it probably felt a little weird. But by the second day, I was all back to normal. And that's just saying, thank goodness for the memories and the photographs, because it does feel kind of distant. But I'm not complaining or anything.
It's only been 22 days, Gary.
I know it has, yeah.
But, let's get right into it. What everyone wants to know: what are the current COVID numbers here at Kaweah?
Yeah. So as of today, we only have 19. COVID positive patients that are in the acute medical center. All of them are adults, and only one of them is in the ICU, and that patient, fortunately, is not on a ventilator. They definitely, generally all those COVID patients are having some type of oxygen support, either a nasal cannula or BiPAP or CPAP. Going on to a mechanical ventilator is kind of the last thing we want to do, but really over the last couple months, not too long ago, just a week or two ago, we were hitting 30. So to be at 19 is one of the lowest numbers I've seen in a while, but we were pretty consistently at 30. But rarely was somebody in the ICU or on a vent, so that's good.
Were they coming in with COVID, or were they here as a secondary diagnosis and then?
Yeah, Kelsey, I'd say it's about 50-50. So about half of the COVID positive patients, their COVID is their primary diagnosis, and it's really what brought them to the hospital. And for the most part, they're real shortness of breath, really having some great difficulty respiratorily, and but then the other half, they happen to have COVID, but that's not what brought them to the hospital. It's definitely a secondary diagnosis. But if you're here because of congestive heart failure or COPD or a heart problem, having COVID can make that condition worse. So we still take it very seriously. We don't ignore it, and we recognize that it could exacerbate the issue that brought them in the hospital. So we're there treating both their primary diagnosis, but also treating COVID at the same time.
When was the last time we've seen a COVID death here at Kaweah?
Yeah, so it's been a little over a week. We did have a patient pass away back on September 14th. COVID was their primary diagnosis and did lead to their death. And then last week we had 2 patients that passed away, but COVID was a secondary diagnosis. And most everybody that is in the hospital with COVID is older than 65, and they tend to have multiple underlying chronic conditions. So we're not generally seeing otherwise healthy people that happen to contract COVID having to be hospitalized. So it's really that more vulnerable population, those that might have be immunocompromised, hypertension, diabetes, obesity, congestive heart failure, COPD, asthma. Those still tend to be the comorbidities that put people at the greatest risk of having to be hospitalized.
Wow, thank you. Well, let's touch a little bit on masking. I know if we were to go to a physician's office, I don't know if it's different physician offices, certain ones, you don't have to wear a mask. Do we still have to wear a mask here at Kaweah?
So we do. So we essentially have to follow, the rules that are laid down for us by the California Department of Public Health or OSHA. And so right now, hospitals, and I thought it was all healthcare facilities, but I'll touch on that in a second. So hospitals that are licensed by the California Department of Public Health, all employees, no matter where you work in the hospital, have to wear a mask. Now, we expect that will be changing. There already have been a number of changes that have occurred here recently. So just a little over a week ago, we got word from the state that we no longer have to do COVID surveillance testing of our employees that are unvaccinated or were vaccinated but didn't get that booster, because that's a requirement of healthcare workers. Is not only do you have to have the original vaccination, but you have to be boosted as well. So we had about 1,000 employees that had filed for either a religious or a medical exemption, and we had honored that, but as required by the state, if you worked in a patient care area, you had to do a home test twice a week and upload your results into the portal. We had to, as a hospital, we had to track that very carefully. If you were a non-patient care employee, then you had to test once a week. We've been doing that for a year now. That actually started last September. So that was wonderful news to hear that we no longer have to do that surveillance testing. Also, we no longer, this just happened, I think maybe this week. So every day when all of us came into work, we had to screen ourselves. We had to take our temperature, we had to answer questions about how we were feeling. We had to keep logs that were carefully documented, and we had to keep those on file and be made available in case the CDPH showed up. And so, again, I think it was late last week that we got word that we no longer have to do that.
That was great.
Yes, and so we've been doing that for a very long time. So, so that was great to see that go away. So, I'm speculating that, given the direction that we seem to be moving, maybe as a country, as a state, I suspect that maybe within a few weeks, we'll see the state start allowing or no longer require masking for non-patient care areas. But I suspect that those that are in patient care areas will still continue to have to mask for some period of time. Sadly, this might be the calm before the storm. We're all worried about the winter months coming. Folks are predicting maybe a heavier flu season. We're worried about flu vaccination rates being really low, that people are kind of burned out on vaccinations. But I would encourage everybody to get their flu vaccination, particularly if it's going to be a rough flu season. But we don't know how COVID is going to behave either. So we know that December of 20 and December of 2021 were really intense COVID periods. And it's just because, as the winter comes and gets colder, we go indoors. We also have a lot of gatherings around the holidays. And so it just, raises the risk of people contracting it. So,
right.
Yeah.
We'll be getting, did you already get your flu shot?
No, I need to get it. Yes.
We still have time. They
Oh,
just
no,
started.
I know. Yes, yeah.
Your
I wanted to
TB
get it
flu.
last week, but my schedule ended up getting messed up, so yeah.
Oh, Gary.
But I get it every year, Kelsey. Believe
Yes.
me, I will, yes.
Okay,
You can count on it.
so with all of this, what does it mean for the visitors? Would our visitor policy be changing anytime soon?
Yeah, in fact, that's probably been the most fluid aspect of this entire pandemic is our visitation policy. I know it's probably been one of the most frustrating aspects of COVID because it ebbs and flows. It loosens, it tightens, it loosens, it tightens, depending on the conditions on the ground. So just this week, we've made other changes to the visitation policy. Again, loosening it up. I don't think we're fully back to pre-pandemic rules and policies, but we're getting awfully close. So I'll just I'll look at my notes here just so I get it right. So for the downtown campus, the main hospital, visiting hours here do remain unchanged, so 9 a.m. to 9 p.m. And then for the ICU and the ICCU, 10 a.m. to 5 p.m. and 7 p.m. to 9 p.m. We do still require that visitors wear a mask. So if you enter through the Kaweah wing, the Mineral King wing, the emergency department, you do still have to wear a mask. But like our own employees, we no longer screen visitors. So you no longer have to go through that screening process of questions and temperature. We also don't have to ask you anymore if you've been vaccinated or if you've been boosted or to provide evidence of vaccination. So you no longer have to do that. So I know that's going to be very welcome news for our visitors. For those that are visiting a non-COVID patient, we allow 2 visitors at the bedside during visiting hours, and you're able to switch out throughout the day. 2 visitors, for the first few hours, 2 different visitors for the next several hours, and so that's what's in place. If you're visiting a patient with COVID, right now we do also allow 2 patients per day to be at the bedside, but we're thinking about actually moving it to the same visitation as non-COVID. So 2 at the bedside and be able to switch out, and 2 different ones. Right now has to be the same 2 visitors, I think, throughout the entire day. But we're looking to again move to kind of the non-COVID where you can have different visitors coming in throughout the day. So we're evaluating that right now. If you're visiting somebody that's having surgery, we allow 2 people now to wait in the waiting room, and we also allow a visitor to go back in the pre-op area before your loved one or friend goes in for surgery, and then also to be there with them after surgery. So 1 visitor there. If you're coming in for a cardiac cath procedure, pretty much the same. We allow 2 visitors to be to be up in the cath lab or the pre-cath lab, what we call the CVC, where the patient, before they go into the cath lab and then when they come out of the cath lab. So 2 visitors by the bed as well. The emergency department let's see if I have this right. Yeah, once the patient gets back into an actual exam room, they can have 2 visitors with them back in the ED, and there can be 1 person in the waiting room. So the waiting room gets really, really packed, and so that's why we kind of limit the visitor to just 1 person to wait with the patient while they're in the waiting room. But again, as soon as they go back into a room, then we allow 2 people to be back in that room. And we do allow visitors to switch out too in the emergency department, and that 1 in the waiting room too. So a lot more flexibility there. In our clinics, again, only requiring that they wear masks, no more of the screening, testing, no proof of vaccination. Mental health, starting on October 1st, we will start allowing visitation on Saturday and Sunday, only for an hour, so from 2:30 p.m. to 3:30 p.m. People will be able to visit patients in the acute mental health facility. In our On our West Campus, in acute rehab, and then in the short stay skilled nursing unit, as well as our skilled nursing and subacute on Court Street. So visiting hours there at those 4 different locations are 8 a.m. to 8 p.m. In those areas, we're still required to screen. So do the temperature check and ask the questions and so forth. So, but we are going to remove, again, the requirement of testing for COVID and to provide proof of vaccination. So that's gone away as well. And we will not restrict visitors, so whether they're a non-COVID patient or a COVID patient, we will allow visitors to both COVID and non-COVID. So that's the latest, and again, some of those changes just went into effect today or yesterday. And again, we're going to continue to monitor, and we're getting very, very close to being wide open to visitation and back to where we were pre-pandemic.
Thank you, Gary. So let's talk about retention and staffing. Where are we with our open positions?
Yeah, still very challenging. So as of the end of August, we had 626 open positions, which is about 12% of our workforce. From a good news standpoint, as of today, just got an email earlier this morning from Diane Cox, our Chief Human Resources Officer, that we have 580 open positions, and that also includes our per diem positions that they're on staff here, but they're not full-time or part-time. They kind of just work on a, an as-needed basis, kind of, as their schedules permit. But they're a very critical part of our workforce. So saw about a 40 to 50 person drop there. So that was really good. I skipped over something. I said, when you were asking about the masking, they said that physician offices were no longer requiring it.
Oh, yeah.
So I had a visit with my cardiologist yesterday. I had to wear a mask the entire time. When I entered, when I sat in the exam room while the doctor was with me, we both had to wear masks. Every single patient that was in the waiting room, all the staff were all wearing masks. And then a few weeks ago, I had a couple diagnostic, just screening procedures, actually at a non-Kaweah facility, and I had to wear a mask the entire time. And everybody else was, and all the employees were. So I think it's kind of hit and miss when you say physician offices that they no longer are wearing them. As far as I know, the state is requiring all healthcare facilities to wear them. So, but folks are getting kind of burned out on it, and maybe just elected not to do it. So.
And it's okay if you're uncomfortable to ask them, do you have a mask? Yeah,
certainly. And even when it becomes no longer mandatory, I mean, if somebody feels more comfortable wearing a mask, then we're certainly going to respect that, and we'll continue to provide them with masks, both visitors and employees. And yeah, good point.
Taking a left turn back to staffing.
Okay.
How many travelers do we have?
Too many. Although we love our travelers, I can't imagine, I can't imagine what would happen if we didn't have these travelers. So we currently have 242 nurse travelers, which is pretty much exactly equal to the number of bedside RN positions that we have open. So we almost have a traveler for every single open RN position that we have. In addition, we do continue to offer an extra shift in bonus payment to our employed staff. So a nurse who typically works 3 12-hour shifts a week, if that nurse will work a 4th shift or even a 5th shift, number one, we're incredibly grateful for that. But in addition, we will pay them time and a half for that 4th and 5th shift, and a very sizable bonus to say thank you, as well as to create, kind of an incentive to do it. And we continue to spend about $320,000 per pay period for those extra shift bonuses.
Wow.
Yes.
And what would happen if we didn't employ travelers at all?
Yeah, bad things.
Yeah.
Yeah, so we would definitely have to close beds. We have about close to 450 beds in the acute medical center spread across, multiple units. Most of the units on the Mineral King wing have about 34 beds. In the Kaweah wing, they tend to be 24 bed units. So as I spoke to Diane, she said those 242 travelers equate to about 1,000 12-hour shifts a week. So imagine that we would have 1,000 unfilled shifts every week. So we definitely would have to close beds, most likely would close nursing units altogether, because we're still subject to nurse staffing ratios, 4 patients to 1 nurse. Some areas 5 patients to 1 nurse. Critical care, it can be 2 to 1 and 1 to 1. So we are not exempt. All the nurse staffing ratios have been put back in place, and we're held to those. And so we'd be forced, again, to close beds. And what would also happen is we would have to significantly ramp down surgical procedures, endoscopic procedures, other procedures. We have lots of travelers in the OR and in the endoscopy lab. I mean, plus, a lot of those inpatient surgeries where they needed a bed, certainly with respect to elective inpatient surgeries, we find ourselves having to close those down again because we didn't have a staffed bed. And in all likelihood, we'd have to go on diversion for the ED, that the hospital would just be full. So I didn't see the census today, but yesterday we were at 98% occupancy across all of our adult units in the medical center. So we continue to be incredibly busy and most every bed full. But that's doing it with 242 nurse travelers. So if we didn't have them, we would, again, we simply would not be able to take care of the number of patients that we currently do. Earlier this week, we spent a couple days with a new candidate. We've been recruiting for a very long time for a chief medical officer, a chief quality officer. It's a very important executive level position in any hospital organization, particularly larger hospital organizations like ours. That CMO and CQO plays a vital role in helping elevate and sustain high quality care, safe care, working as a liaison between the hospital and its medical staff, a really impactful position. And so we've been very selective. We not want to rush into this, but we interviewed just simply an outstanding candidate this week, Dr. William Willie Bryan. Dr. Bryan worked at Cedars-Sinai Medical Center for 17 years. He was the chief of orthopedic surgery. At one time, he was also the chief of staff there. Then he went to Baylor St. Luke's Hospital in Houston, Texas, where he actually served a short stint as the president and CEO of that hospital, but he really was hired there to be that CMO and CQO. And then he went to University Hospitals in Cleveland, which is a large 25 plus healthcare system, kind of rivals the Cleveland Clinic in northeastern Ohio. But he's come back to California. He is super excited about this opportunity. He definitely knocked it out of the park here, and we very much hope that he kind of fell in love with our hospital and the local community, and he wants to come back and spend a little bit more time before he makes his decision, but we fully intend to make him an offer. I have not known somebody personally that had their own Wikipedia page. So if you want to Google Dr. William Willie Bryan, spelled B-R-I-E-N, he is the grandson of former Supreme Court Chief Justice Earl Warren, who also was the governor of California. So Dr. Bryan is his grandson, but Dr. Bryan himself also is rather, I don't know if I'd say famous, but highly regarded across the country for his knowledge and skills. So he's looking, he and his wife would love to get out of the he also was the mayor of Beverly Hills for a number of years. So yeah, he just was a fascinating guy, and hopefully he wants to roam more of the rural area of Tulare County, loves the mountains and everything. So we're excited about that. I think I've also mentioned that we've been working with Stanford Health System, specifically Dr. Joseph Wu, who heads up their cardiothoracic program. He's the chief of the cardiothoracic medical group, and we've been working with him and Stanford to bring Stanford cardiothoracic surgeons here to Visalia. And so while I was gone, our board approved entering into a formal affiliation agreement with Stanford, and they have already started recruiting for 2 cardiothoracic surgeons, cardiac surgeons, that would join the Stanford Cardiothoracic Medical Group. They'd be part of the faculty and part of that medical group, but they would live and practice and be part of our community. And they would join Dr. Mayer, who we're incredibly grateful that Dr. Mayer has come back and is doing phenomenal work here. But ultimately, Dr. Mayer does want to retire, and so this would provide a wonderful transition plan for Dr. Mayer. He's looking for probably a couple more years, but I would imagine he would continue to, work in more of a part-time capacity once the Stanford folks were here, and then we would most likely co-brand the cardiac surgery medical group with Kaweah Health and Stanford Health. So really excited about that. I think you're aware that on a similar track that we had been working with the University of Southern California Department of Urology at the Keck School of Medicine, and world-renowned Dr. Indy Gill, who is the chair of urology at Keck. We actually have fully executed our affiliation agreement with them, and they are actively recruiting urologists to join our community. We right now are remodeling our specialty clinics on the corner of Mineral King and Willis, and the urologists will practice alongside Dr. Ford and Dr. Pra in our community. We all know that that urology, gastroenterology, significantly under-resourced specialties in our community. So I think Dr. Ford and Dr. Pra are excited about them coming here. And then also the subspecialists that work at USC will come here usually once or twice a month to provide subspecialty urology care that our patients would normally have to leave the community, so can now stay here. So we're looking probably October, November for Dr. Gill's team to arrive and again live and practice in our community. We continue to move ahead on our master facility planning for the downtown campus. Incredibly challenging. So we, am I getting the hook over here? Is that, oh, okay, we're good. So yeah, we've kind of settled on what looks to be a 10-story tower that would replace all of the beds in the current Mineral King wing, plus add some additional beds, so close to 240 beds, but also would provide new operating suites and a new post-anesthesia care unit, or PACU. A lot of our ORs in the PACU are in non-seismically compliant space right now. So we kind of settled on that and the design and what it would look like. Unfortunately, the cost is somewhere between $700 million and $730 million when you factor in escalation of costs over time. This certainly, couldn't come at a worse time for California hospitals that are trying to recover from the pandemic, financially as well on many different fronts. But California hospitals, including Kaweah, have been hit incredibly hard. We don't have the financial wherewithal to move forward on this project. So actually I've asked Mark Mertz and Kevin Morrison and our team to really study different scenarios. The best scenario is that we would build this new tower with the help of our community and the support of a property tax measure. But we could also continue to use the Mineral King Wing indefinitely, that there'd be some type of relief provided under Senate Bill 1953. That would be ideal. If we couldn't accomplish all of that, at least building the tower and be able to have a new modern state-of-the-art facility and not be able to continue to use the Mineral King Wing past 2030. Third scenario is we could not afford the tower, but the state would continue to allow us to use the Mineral King Wing indefinitely, as long as we've made what they call non-structural performance category upgrades, which are a lot of bracing and still earthquake proofing, but not actually having to remodel and brace the facility itself. So that now we're moving along kind of the worst case scenario, but certainly much more affordable. The far side of the spectrum is that we can't afford to do the tower and the state grants us no relief, and we cannot use the Mineral King Wing past 2030. So we're studying then what would that mean, and I think that's the proverbial plan B that folks often ask me about, and really it's, we'd be a smaller hospital. We have the Kaweah Wing, the 6-story tower with about 135 beds and ORs and cath labs, and we have the East expansion that houses the ED and the Broderick Pavilion and labor and delivery. We have the West expansion that houses the ICU and the ICCU. So those are all seismically compliant and can be used beyond 2030. And so we'd have to figure out, how do we become a smaller hospital? And what services do we continue to provide here? And what services do we have to, arrange for transfers? And a lot of hospitals are, having to contemplate that same scenario. We'd also look at our West Campus. We have a 61-bed acute rehab hospital out there. Could we repurpose that to provide medical surgical care? So so a lot of work still moving on that front. And then I'll end the update with a secret.
Ooh.
Yes.
Do
so I talk about this a lot. I mean, we're very proud of the work that Kaweah does, and there's an independent organization out there called Health Grades that evaluates 4,500 hospitals across the country, across all different aspects of care, the avoidance of mortality, complications, infection rates, positive outcomes, and so forth. And we've been just recently informed that we once again will be the recipient of some outstanding awards. For 7 years in a row, one of the top cardiac surgery programs in the country. In fact, we are in the top 50 in the United States in cardiac surgery, and we are the second in the state of California. We are ranked number 2 in cardiac surgery in California, behind only Stanford. Quite the accomplishment. But the most secret news, and I'll have to deny that I shared this with you if it gets repeated out there, because it's actually embargoed until February of next year when they'll release it. But I think you're aware that Kaweah Health has been named one of the best 250 hospitals in the country out of those 4,500 for 4 years in a row. Well, we were just informed that we have now been named such for the 5th year in a row. But we've kind of moved up a little bit. We are now one of the top 100
Ooh.
hospitals in the nation. So
Kudos.
the first time in our history out of 4,500 hospitals to be named in the top 100, again in the avoidance of mortality, complications, infections, and positive outcomes. So outstanding work by our staff, our providers, our physicians, our advanced practice professionals. Couldn't be more proud of this organization. So we're really, really excited about that, but given the close, unique relationship we have with all of you, I thought I would go ahead and share that great news with you.
Thank you, Gary.
Yes.
That's exciting.
You almost want to end on that, I know.
We have to end on that because we're done. We're out of time.
Okay. All right.
Do you want to take it away?
Yeah, just it's a pleasure to be back with all of you. You know, it feels so comfortable being back here, and thank you, Kelsey, for joining me today. And just want to wish everybody a fantastic weekend. I do see that it's going to kind of heat up a little bit, so we've been a little bit spoiled earlier this week with these almost coastal-like breezes and temperatures. So, but I'll take mid-90s any day over hundreds.
Absolutely.
So hopefully we're now into the formal journey into the fall and then the winter. So just again, thank you to all of you for all the support that you have for Kaweah Health, and we're incredibly grateful, and we take our responsibility to take great care of you very seriously. So we'll continue to do our very best to meet your healthcare needs. So thank you all, and have a great rest of your day.
Goodbye now.